There's been a lot of news recently about increased investment from the Ford government into private healthcare facilities, but not a lot of people know what privatization actually means in the context of our health system and why it's detrimental to our public healthcare system. So in Ontario and across Canada, we are supposed to have universal healthcare access, meaning that no matter how much money you make or how much money you have, you should be able to access the same quality of care as anyone else, whether you're in a small town or a big city. But what's happening right now is we're seeing that our public healthcare system is being systematically underfunded by this government. And what that's looking like, it's looking like longer wait times for specialty care, longer time sitting in an emergency department, sitting in a hallway when you're admitted to hospital instead of actually getting a hospital bed. And it's resulting in a lot of frustration for many people in the system. And what this government is suggesting as an option to try to alleviate some of that strain on our healthcare system is by shifting to private healthcare models. This isn't new. We've seen this in years past. We saw it with cataract surgery, and now we're seeing it with announcements for orthopedic surgery and other procedures. But what that does is, on the face of it, it might reduce wait times somewhat in some circumstances for those specific procedures. But what those private healthcare facilities do is they charge extra money called facility fees to do those procedures outside of a public hospital. So if you're getting your knee replaced in a public hospital, it's going to cost one amount. And if you're getting your knee replaced in one of these private healthcare facilities, it's going to cost about $6,000 more. And that's all paid through our public system. So that means less money going into our hospitals, more money going into these private clinics. And what it also means is that we're losing staffing, because instead of all of our staff staying in the public system, we're seeing nurses, technologists, surgical assistants go to the private healthcare clinics where they can be paid more. That then means that our public healthcare system is further strained. We're going to see further wait times, and we're not going to see our public hospitals working to their full capacity the way that they should. What we should do instead is invest in our public healthcare system, make sure that we're paying people enough so that our public hospitals are adequately staffed so that they can run to their full capacity, reduce wait times, and maintain the same quality of care for every single person across Ontario.